Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. We test a lot of patients for various hormones related to the reproductive system, one of which is the Beta-HCG hormone for pregnancy. Many patients are confused as to what a positive pregnancy test means, and I'm going to explain this to you in today's video. So a Beta-HCG is the hormone that we detect when we do a pregnancy blood test, and when you get a positive pregnancy test report, it means that this particular hormone has been detected in your blood sample above a certain threshold. Now, this is a hormone that is created by something that is called the placenta. The placenta is the connection between the developing fetus in your womb and your body. The fetus or the developing child or infant and your body are connected together by means of a tissue which is called, it's like a broad flat kind of tissue, and it is called the placenta. This is the placenta, this is the tissue that makes this Beta-HCG hormone which we detect in these pregnancy tests. So it's easy to understand that if the Beta-HCG hormone has been detected beyond a certain level, it's safe to assume that this has been created by the placenta, and the placenta can only exist if you actually are pregnant. And that's what a positive Beta-HCG test actually means. It's important to remember that the Beta-HCG test is detectable, we get a positive or a value above the cutoff only around 8 to 10 days after conception. That means 8 to 10 days after the sperm and the egg have united. Only 8 to 10 days after that can we actually detect the Beta-HCG, because it takes that long for the placenta to form. So a positive test in a woman of reproductive age who is sexually active will most of the times, 99 maybe 99% of the times, will indicate a pregnancy. There are other reasons why it could happen which I'll go into in this video, but for all practical purposes, if your Beta-HCG test is positive, if your pregnancy test is positive, that's what it means. So the first question we get is, my Beta-HCG test is positive, does it mean I'm pregnant? Yes, as I indicated in the earlier part of this video, if you are in the reproductive age group, you're sexually active, and you have missed your period, a positive Beta-HCG test almost certainly means that you're pregnant. This will need to be confirmed. Your doctor will ask you to get another Beta-HCG blood test done at least 2 to 3 days later, and they will also ask you to get an ultrasound scan done, which is a scan that is done on your stomach to check for visual proof of the pregnancy around 5 to 6 weeks after your missed period. Number 2, there are situations, very rare, 1 in 1000 cases, where the Beta-HCG test can give you a false positive result. This happens in patients who have certain diseases like autoimmune diseases, which is a situation where the body creates proteins to fight against itself. It can also happen because of certain medications and errors while performing the test. There are also some rare causes for these elevated Beta-HCG levels, which are certain types of rare cancers. But by and large, a positive Beta-HCG test almost certainly means a pregnancy. It does not tell you whether your pregnancy will be successful or not. It only tells you that yes, there has been conception, the sperm and the egg have united and created an embryo which is now attached to your body. A fetus is attached to your body in the uterus through the placenta, which is making this Beta-HCG. What are some other situations in which you can have a positive pregnancy test? Well, these are all pretty serious conditions. One is called a chemical pregnancy. A chemical pregnancy is when the Beta-HCG level rises because there has been conception, the sperm and the egg have united, an embryo was created, but immediately after that you have had an episode of bleeding and that embryo has been lost, or it is a non-viable embryo. This is called a chemical pregnancy that does not proceed to a biological pregnancy, and it's one of the reasons why the Beta-HCG test could have been positive but you still don't show any signs of pregnancy. The other situation is a recent miscarriage or an abortion that can show a positive for up to 4 to 6 weeks because the HCG levels take some time to lower down, to reduce, and that can also give you a positive Beta-HCG test without really showing any real pregnancy.